All right, so me as a pediatric feeding specialist, I do sometimes have a client come to me with a known diagnosis as such as ARFID, for instance. But what I have told a few clients lately is that it's not that I feel it's hard or difficult to diagnose. It's just that I feel like it is still that category, or how that is. I don't even know like the terminology that I'm trying to explain. Like, there are different descriptions, different disorders that fit within different realms of different specialties. So, for instance, a psychiatrist may be more likely to diagnose ARFID, or a pediatrician, where for the last 18 years plus, this still fits the clients that we have seen in that time frame and before, where I might describe it in an evaluation as this child has a pediatric feeding disorder, which is, by the way, an ICD-10 code now, with pediatric feeding disorder with a lot of sensory influences. That's how I describe it, because I feel like when you get right down to it, regardless of is this ARFID, what caused it, yes, sometimes there's traumatic incidences and the trauma could be infant reflux, or different difficulties that come with prematurity, or just various things. So sometimes it's kind of like, which do we focus on, this specific diagnosis, or this, or the treatment that you would use to approach someone that fits these descriptions of, my child has 3 foods, that's it. When they see that I'm even trying to make something differently, they're like watching me like a little micromanager. That's a very common description with so many of my clients. And it is, I mean, I know what would be the most helpful for this family at whatever given time, based on just a thorough feeding evaluation. But when someone's coming to you with, I don't know how to explain it, my child has a few foods, they're kind of brand specific, or not even that. I mean, it could be that we've always been able to at least rely on grilled cheese sandwiches, or these certain foods, but all of a sudden they won't have them anymore. What they're experiencing are food jags, where you get burnt out on something that is in your core diet, but you don't yet have something to replace it with. So, they're experiencing food jags. And then it just narrows down further and further, where in theory, yes, if you have a child come in, if you're a pediatrician watching this, for instance, if you have a child come in and they're within a great growth chart, height, weight, everything, they may be able to supplement with Pediasure or Boost. That's one way to look at things, because it's good to have those backups. But in the bigger picture, the bigger scheme of things, obviously you want to develop a healthy sense of, even if it's even if we're talking about goldfish versus gold penguins, not being able, some kids that even just that alone is, no, they won't do that. Take the autism spectrum, for instance. That's something that we address a lot in therapy, are those tight associations with certain foods, and it not just being like, when you're hungry, you'll eat. That's great when that can happen, but that is not the reality for a lot of these families. Unfortunately, they just need someone to listen to them, develop a plan, and realize that it would be great if we were just dealing with hunger as the factor, which, again, ideally that would be great, but sometimes you need a specific plan to address. We need the balance of hunger, plus a lot of exposure, a plan for incorporating everything that will help expand a diet based on what they're already accepting, which may be very limited. And it is very challenging. And I wish that all the families I've worked with over the years could do, a little interview on the description of what they experience, because I feel like they are the ones that could reach out to so many others more than any of us can as a caregiver or as a professional working with that child.